Hi everyone, just a couple more minutes and we'll get the party started. What's going on, Dr. Wolkin? We're on here talking about acne. We're just waiting for Dr. Shah. And there he is.
How's it going?
Colin, how are you?
Getting adjusted here.
Yeah, get situated, get situated. I'll talk to the people while you get your life in order. So, hi everybody. You ready to rumble?
Oh, I'm
Ready
ready.
to
But
rumble. I
let's
love
get the
it.
people. Let's get the people in the chat here.
Oh,
Because,
it's going, yeah.
well, just for everyone to know, we plan to answer questions in the chat. So the more questions that you leave, the more likely you are to get your question answered. So, anyway, go ahead. We'll let you do your.
Yeah, for sure. Thanks, Dr. Shah. So, everybody, my name is Danny Annis. I'm a board certified dermatologist in Washington, D.C. I mostly focus on cosmetic and laser surgery. And we're here today with the American Society for Derm Surgery to talk about acne. And we thought that this is a really important series because there's so much misinformation on the internet, especially with regards to acne. And so there's no better person to be joined by than Dr. Muneeb Shah himself, a board certified dermatologist known to millions across social media as the Derm Doctor, somebody that dedicates most of his time to educating on social media and dispelling myths. So thank you so much for coming here tonight.
First of all, thanks for you taking the time out to do this here. This is amazing. So I think we're going to bounce ideas off of each other so we can lean a little bit on your cosmetic expertise here. So I think we're going to gain a lot from this, especially when it comes to acne scars.
Yeah, for sure, for sure. And before we jump in, the audience sort of knows me through ASDS, but I'd love for the audience to get to know you a little bit better. So tell me a little bit about your path into medicine and dermatology and what it is you're passionate about. Before we jump into acne, let's hear a little bit about you.
I'm passionate about everything. I think that's what led me here. In medicine, the reason why I went to med school was because I love the science, the biology, and the way that we could study something, develop medications, and see how that affected human beings. So, like, the idea of the science is what I loved. But I didn't fall in love with patient care until I was probably like an intern in medicine, because I was initially going to do radiology. I had matched for radiology, was going to study, like, evaluating images and making diagnoses. Did a year of radiology, and I ended up actually switching into dermatology because I loved patient care so much and I really wanted to have that human touch. I love dermatology because it's something that we all can see. So when you have a treatment, whether someone has a skin condition, good or bad, whether or not we can actually make a difference or we can't, like, these are things that people can see and they care about. And when we're able to make a change, especially with something like Accutane, like, that's going to improve their quality of life, their confidence. And so for me, it's kind of selfish in a way, because being able to see the results of my efforts really, really made me feel like my job was meaningful. And so I absolutely fell in love with the field of dermatology. And then I took that knowledge to social media to educate people. And that's been a big passion over the years. Am I cutting
Yeah.
out?
Let's see here. I can still hear you. Can you hear me okay?
I can hear you okay, but
Oh,
somebody said I
perfect.
was inaudible. So I don't know if
I,
that's
you're perfectly audible to me, so I know
okay.
it's here. I just wanted to say I love what you said about acne being so gratifying as a dermatologist. For me, I've been doing this for some time now. Acne is still my favorite thing to treat because you see the results and you know that it's going to get better, and that's the best part about acne. So that's why I think it's kind of fun that we get to talk about it tonight. And the chat is already filling up with questions, a lot of which we'll hopefully answer back and forth, and we'll take some dedicated time at the end to answer questions, if that sounds good to you.
Perfect.
Good. So let's take the 10,000-foot view here and just tell us in general your approach to management of acne. Before we get into procedures, which really is the derm surgery side of things, tell us about acne.
Right. So I look at acne as first for all of my videos, especially if you go on YouTube, I approach everything with what causes it and then how to treat it. So with acne, the main things that you deal with are your pores being clogged because your skin cells are too sticky, the buildup of bacteria inside of those pores, the inflammation that occurs afterwards, and then some of the scarring that occurs after that. And so when we're treating acne, we try to target, and the oil production, right? So we try to target all of these causes of acne with our treatments. So if you're able to see a dermatologist, if you're fortunate enough to see one of us in the clinic, then we're able to offer you a lot of different treatment options that are going to be very much tailored to you. If you're somebody who doesn't have access to a dermatologist, then I say what's available over the counter nowadays is so much better than when you and I were growing up, right? We had what was available to us was horrendous compared to what's available today. And so my approach is, if you can't see a dermatologist, go for those treatments over the counter that have the FDA approval for acne, which is your salicylic acid at 2%, adapalene, and then 0.1%, and then benzoyl peroxide from 4 to 10%. Like, those are your cornerstones of treatment for acne that's available over the counter. Now, if you've exhausted those options, then it depends on what kind of acne you come and you see us with. So we look at acne as, it depends on who like how you evaluate it, but mostly mild, moderate, or severe, or some people break it down into like comedonal acne, which is the little bumps, blackheads and whiteheads, inflammatory acne, which is your pus-filled bumps, or your nodulocystic acne, which are those like deep-seated nodular acne bumps that are really painful and lead to scarring, right? So it depends on what stage you come to see us in, right, is going to determine the treatment, and more aggressive if you have more aggressive acne. So for you, like, for example, like when someone comes to see you with comedonal acne, what would be your go-to for that?
Yeah, so for me, it's all about breaking those comedones up. So I love a good retinoid. You mentioned adapalene being available over the counter. It's funny, that wasn't a thing when I was in medical school. It wasn't that long ago. I'm not that senior, but just recently that's become available over the counter. So I think that's retinoids are essential, whether it's adapalene or tretinoin or tazarotene. That's really essential in breaking up those comedones. And then I'm a big sucker for chemical peels. So those Gessner solution, glycolic acid, something to help really break up those comedones is essential, if you ask me.
Right. So when we talk about chemical peels, that's something that, I mean, there are exfoliants available over the counter, but not nearly at the concentrations that are available at your dermatologist's office. And so chemical peels are something that, once you see a dermatologist, have tremendous benefits to the skin. They're going to quickly break apart those comedones for you, turn over those skin cells, and help to heal your acne very quickly. And it's also a good option for the acne scars that come afterwards, whether it be hyperpigmentation, post-inflammatory red spots, or post-inflammatory erythema, and even some of the deeper scars that come afterwards. So I love that as a treatment option when people come to see me, because it's something that I can do as part of an acne visit, where we can do a quick chemical peel and then have you looking better within a few days.
Right. And it covers, so like you mentioned, pathophysiology of acne being inflammatory, being pores being clogged, bacteria that are there, and then leaving behind hyperpigmentation. When you have a peel, you're unclogging those pores, you're reducing some of that inflammation, and you're helping to clean up some of the pigment that's left behind. So that's just, my favorite thing, but I'm a sucker for a chemical peel for sure. But I've seen a lot of people come in with at-home peels, and they get burns and things like that. So
That's what I wanted to talk about. How frequently would you say people should be exfoliating or using these higher strength chemical peels?
Yeah, so it really depends on, I think, the skin type. Some people can tolerate a chemical peel every 2 to 4 weeks. Some people, they do one, and their skin, there's a lot of people mentioning in the chat that we've brought up these acids into play. A lot of people are mentioning that they get really irritated. So some people don't have the oils or the sebum in their skin to help dial back that irritation. So they really, really need to moisturize, whether that's with their retinoid or with their peels. So I really have to gauge it. And that's the cool thing about acne, is it's very, very individual, and it involves their skincare too. So it's about kind of gauging how oily somebody's skin is, how dry somebody's skin is, and that really determines how frequently they're retinizing their skin and they're peeling their skin, I'd say.
Yeah, I totally agree with that. One thing I'm curious to hear your point of view, because this is
Mm-hmm.
the tougher types of acne to treat that I think a lot of people actually have, which is your dry skin acne person, right? So like when someone comes and sees you with dry skin and acne, I think we have to approach that a little bit differently, like you mentioned. And so what would be some of your go-to treatments for that?
Right. It's so for me, it's all about that moisturizer. Getting a ton of moisturizer on the skin, following the tretinoin or retinoid or whatever it is. Try to dial back all the irritants that are going on the skin, and then moisturize, moisturize, moisturize. So I'm a firm believer, and you might feel differently, and feel free to jump in, but I'm a firm believer that everybody can tolerate a retinoid or retinol of some strength if they moisturize enough. And that's really what I think. Now, people might feel too greasy, etc., but I'm curious to know how do you adjust for people with dry skin?
Yeah, same thing, just adding hydrating because a lot of the treatments are drying, right? Salicylic acid is drying, benzoyl peroxide is drying, your retinoids are drying. And so introducing something that's a moisturizer is awesome. Even something like clindamycin lotion, which is a moisturizer, antibiotic moisturizer, is just something I consider more like the vehicle in which I prescribe things, I consider more like, so if someone has really oily skin, I may prescribe a gel formulation. If somebody has drier skin, I may prescribe a lotion formulation. And so I totally agree with you. If introduced properly, like if you introduce your retinoids slowly, you moisturize before and afterwards. I've never had anyone where I couldn't get them on a retinoid if they needed it or I thought it was going to be beneficial for them. So I totally agree with you.
And a lot of people have what I call a false start for retinoids, where they start it and they get really irritated, and it's real. They're hesitant to continue. I feel like the trust in that active ingredient has been eroded, and so for me, it's you got to rebuild that trust, and it's a process. So maybe starting every third night or every other night and building up to using it every night works really well. Somebody in the chat mentioned azelaic acid, which is a nice retinoid alternative per se. There's a lot of sort of retinoid alternatives, but if you ask me, nothing quite does acne like a retinoid does.
Yeah, I totally agree with you. And that's why, because retinoids or tretinoin, first formulated as retin-A was discovered in the 1970s. And so we have data going over 50 years now for the treatment of acne with tretinoin and other retinoids. And so that's why, like, you hear these ingredients that come and go in skincare, whether it be, snail mucin or hyaluronic acid or just really anything. And I do like azelaic acid a lot as an ingredient, but nothing has really withstood the test of time the way that tretinoin and other retinoids have. Mm-hmm. So I completely agree with you there. I like azelaic acid for obviously our pregnant patients that can't use a retinoid or people that suffer from post-inflammatory hyperpigmentation. That tends to do really, really well for those people. But I agree with you. Tretinoin is just a total killer for me, and I absolutely love it. Someone mentioned here, which is a good question about Winlevi. They said, quotes to live by inspo said, thoughts on the new Winlevi topical cream. Do you have any experience using that yet?
I do. And it's funny that I was just going to mention to you, we've spent a lot of time talking about the tretinoin, which I always explain to my patients that retinoids reprogram the skin from the bottom up to grow without acne. But they can only do so much. And mostly in women, but also in men too, I consider just about all acne to have a hormonal component as well. And so for me, that hormonal component has to be addressed if it's there. Otherwise, it's not going to get any better. So you mentioned Winlevi, which is a topical clascoterone, which helps to act against androgens or male hormones, which help to promote acne. There's also oral spironolactone for women and birth control pills for women as well, which help to get at hormones. But, both spironolactone and birth control pills come with side effects. So the Winlevi is interesting in that it's really, every medication has side effects, but it's not a systemic medicine, and it gets at that hormonal component of acne. I've had some good success with it. It's been out, or I've been using it, I would say, for a couple of years now. It really hit the scene when I was finishing up my residency, and I have some patients on it that do really well, and for others, it doesn't quite cut it. And I would say for the more moderate to severe hormonal acne, typically they end up needing something oral. I don't know, what's your experience? The same?
I agree with you. Again, going back to because hormonal acne is a very popular term to describe acne that's usually occurring in women in their 20s, 30s, and 40s that occurs along the jawline, right? But like you said, all forms of acne are really hormonal, right? Because we see it peak during puberty, and the reason why is because the androgen receptors acting on your sebaceous or oil glands is what's triggering a lot of acne. So that's all forms of acne have some type of hormonal component, and so you can benefit from topical Winlevi. In my experience, which I've only used it on a few patients, it's like hit or miss, and some people don't like that you have to refrigerate it, and some people don't like the texture of the formula. But I think it's nice to have more tools in our arsenal to treat acne, because a lot of times a lot of the treatments, like we said, are drying, whereas this isn't as drying as some of the other treatments that are out there. So it's a good option. And like you said, we have oral spironolactone, birth control for the appropriate patient, and then even topical spironolactone you can get compounded from compounding pharmacies. It's not available by like an FDA approved prescription, but there's some good data to support topical spironolactone would work similar to Winlevi. So it's just another thing that we could potentially use.
Yeah, there are so many weapons in the arsenal. And then, at the end of the road, if nothing works, we have isotretinoin in our back pocket, or Accutane, as many people know of it as. And poor isotretinoin, I think, has really been demonized out there. But, for the right patient, it really works really well. And so I would say I've had so many people that come to me that really wish they had gone on it sooner, and that they've done so well on the medicine. And that, for me, those are the most gratifying cases, seeing somebody go from being covered in acne to have perfectly clear skin with the scar or two. That is why I became a dermatologist.
100%. Yeah. So anytime I bring up Accutane, it inevitably brings a very lively comment section, right? Because it's been demonized in a lot of ways. And I think it's because some people, a very small group of people, have had bad outcomes with their Accutane, and they're very vocal about that experience. And in the vast majority of people, it is a life-changing medication. Like I totally agree with you. There's nothing better than seeing someone at the beginning of their Accutane experience to like 6 months down the line, and just the way that their personality changes, the way that their confidence changes, the way that they smile more in those appointments. That's like what gives me gratification in what I do. And Accutane, there are very few medications in any form of medicine where you can seek a cure, essentially. And Accutane is one of those that works tremendously well for almost 80 to 90% of people that I put it on. And it's life-changing. And there are side effects, and every dermatologist is going to monitor those side effects. They're going to look at your liver enzymes. They're going to look at, they're going to evaluate you for mood changes and all those things. So we try to give it to you in a way that's going to be safe and effective for you. Everyone's going to experience some degree of dryness, but I agree that it's a life-changing medication.
Right. And I mean, it's a game changer for so many patients. And there are some comments in the chat talking about more procedural options for acne, and that's really the only thing that we haven't touched on. And there's a lot that's sort of on the horizon. There's a new laser treatment that works specifically for acne. There are some new lasers that are focused primarily on targeting the oil and the sebaceous glands. And then, there's the tried and true pulse dye laser for patients that sort of really flat red acne. So there are so many different approaches. And the other thing is, a lot of these treatments, with the exception of the Accutane or the isotretinoin, can be mixed and matched. And so it's about finding the right combination and the right regimen for the patient.
Yeah, let's talk about this new laser that targets like oil, sebaceous glands. This is isn't this from your alma mater?
It sure is. The Mass Hospital, where it
yeah.
all began. Yeah.
Tell us about this.
Well, I don't think it's commercially available yet. It's still in sort of the testing phase, but, it could potentially be a game changer, not just for acne, but also for patients with a condition called sebaceous hyperplasia. If you've ever seen, for the audience, people with those sort of yellowish bumps on their face as they get older. So, I wish I had a lot to tell you about it, but the cool thing about dermatology, especially in cosmetic and laser surgery, is that there are so many new technologies coming down the pipeline. And I feel like in the world of dermatology and skincare, we've really just scratched the surface of the iceberg as to all the technology that could be. There's so much research that's happening.
Yeah, I think if anyone's like a major nerd, skincare nerd, science nerd, especially if you're in medical school, pre-med, PA school, like definitely consider dermatology because I think a lot of what we see on social media relates to what's available over the counter. So a lot of skincare stuff. There's a lot of stuff on like pimple popping, but like when you kind of take down the curtain, there's so much science in dermatology, especially when you talk about laser medicine. That's completely fascinating, right? Like we
Mhm.
can tailor a wavelength to specifically target a color that will have some type of effect on the skin, whether it be, getting rid of blood vessels on the skin in rosacea, or getting rid of tattoos or pigment, or like you said, targeting these oil or sebaceous glands. Like that type of stuff is really fascinating what you can do with laser medicine. And those things are always being developed. And you mentioned other treatments for acne. Blue light is an option for people if
Mhm.
or friends that are involved and help to kind of eliminate that. And it can also decrease oil production and decrease inflammation. So blue light, you have this sebaceous gland laser. Let's see what else. That's for like the active forms of
Yeah,
acne, and then chemical peel.
exactly. So we've talked about a lot of treatments for active acne, but I think a lot of what we do procedurally is the aftermath, the hyperpigmentation, the acne scarring. So a lot of people are asking about that in the chat too. So let's start with acne scars. Tell us a little bit about acne scars and your general approach and sort of how you evaluate and manage acne scarring.
Absolutely. So first thing I say is if you're still getting acne, we got to treat your acne first to be able to focus on the scarring because treating your acne helps prevent the scarring. And
Totally.
it is much more difficult, I think you would agree, even though you're doing a lot of cosmetic stuff. It's much easier to treat acne than it is to treat the scars that come
A
afterwards. And
hundred.
so, yeah. So being aggressive with your acne treatments is very important. And then once you have acne, once your acne has calmed down and you're just going to treat the scars, my approach is really to evaluate on what type of acne scars you have, because that's going to determine the treatment. Now, if you have like the red spots that you mentioned, that's called post-inflammatory erythema. And then if you have the dark spots that occur afterwards, that's post-inflammatory hyperpigmentation. And if you have the more deep punched out scars, like the ones that actually cause surface changes in the skin, those are atrophic acne scars, sometimes called boxcar scars, rolling scars, ice pick scars, and those are going to be treated completely differently. So let's start with the red spots that occur afterwards. The good thing about them is that they usually just resolve with time, but let's talk about some of the laser treatments that are available for that.
Yeah, so there are a lot of lasers that target vascular wavelengths to help with post-inflammatory erythema and also sort of so-called macular erythematous or flat red scarring after acne. And so for some patients that have it really badly, I will even, and of course off-label, but I will even, while they're on their course of isotretinoin, start laser treatments to help with the redness. And so laser treatments are major for patients with this so-called post-inflammatory erythema, I would say. And then, again, you mentioned treating the active acne first. I always use the analogy, not to go back to that, but I always use the analogy that the lasers that we use for acne scarring are like a mop cleaning up the puddle, but you have to turn off the faucet first. Otherwise, there's no point in wasting your time cleaning up the puddle. So, yeah, back to laser. I love my trusty pulse dye laser, 595 nanometer. And also I've been using a lot more 532 frequency doubled long pulse YAG as well. And it works really well to help with the redness. And it really, the choice of laser has to be tailored to the patient's skin type as well. It's really important.
Yeah, so lasers, bringing it up, because we're on the ASDS right here. So, people that are trained by the ASDS or are board certified by the American Board of Dermatology, we receive special training in lasers. And the reason why this is really important is because lasers can be extremely dangerous if used incorrectly. So you'll see a lot of videos online of people getting burned by lasers, having scarring from lasers, having blisters from lasers, and a lot of that is because, like he mentioned, if it's not targeted towards the right skin tone, you can really cause a lot of damage. Now, you can have an adverse outcome regardless of how well trained anyone is, but just trying to reduce the risk is super, super important. And so for somebody who's going to get laser treatment done, like, for example, how many treatments would you say for redness, just to
Yeah.
give an expectation?
I tell everybody that each laser treatment is incremental. So some people just get one treatment and they're good. They come back and see me the next time and we can't even find what we were lasering. For most people, I tell them it's a series of at least 3 to 4 treatments. And each time they do it, it'll get better and better. And, we'll do as many as we need to help things get better. But to your point, avoiding complications is super important, especially in patients that have been on isotretinoin, that may have more sensitive skin, patients of darker skin types. So yeah, definitely really important to see a dermatologist, somebody that's well trained in operating these lasers. There have been studies that have shown, nowadays there are so many Groupons for laser surgery, and you can go anywhere around the corner and get your laser done. But there have been studies that have shown that the majority of the complications occur outside of a doctor's office. So really important to see somebody that knows what they're doing. But I usually say, a couple sessions should be expected. And usually a lot of treatment of acne scarring is combination therapy, at least in my office, because most people have more than one type of scarring. So some people will have some rolling scars, some of those ice pick, those deeper, sharper scars, some boxcar scars, which are more punched out, and then some of the flat red spots. So it's about knowing which of those lasers are safe to combine together, which energy-based devices are safe to combine together in the same day, and then using them appropriately. So it's not like we just focus on the redness. We focus on the overall health of the skin is what I tell the patients. So lots of times that means using many different devices. So for ice pick scars, I know you have a lot of experience using TCA Cross. Is that right?
Yeah, so we use TCA Cross essentially as trichloroacetic acid. It's an acid that is super high concentration that you would not want to use over the entire face. And you just basically use the end of a Q-tip to basically dab it into those spots. It creates like a chemical peeling reaction within those spots and helps to fill out those deeper ice pick acne scars, which are very difficult to treat. So that's just one tool that we have. And what I like about it is it's something that you can do quickly as part of even an acne visit, like a simple acne visit. You just dip and you dab, and then they tend to do very, very well. And so again, like another tool that we have are these peels.
Yeah, and super strong peels, obviously not safe to use at home at all, but they work really well in the right patient. And they're safe in most skin types if they're used correctly. So TCA Cross, definitely great. I like to combine it sometimes with subcision, which involves taking a coring needle to go under the skin to break up that tethered down scar. That works really well. Another tool that I've been using a lot more in my practice for acne scars is radiofrequency microneedling. So basically, it's a device that takes sort of a grid of needles, and the needles are insulated, and they go into the skin, and only at the tip of the needle do they inject radiofrequency energy. And that's basically a very controlled injury to help your body build collagen to fill in those sort of atrophic scars. So I've really been liking that as a treatment.
Yeah, that's one of the treatments. Again, again, it's one of the, when we're talking about skin tones, it tends to be a procedure that's safer for most skin tones.
Totally.
Microneedling without radiofrequency and microneedling with radiofrequency. And so that's become a big favorite of mine as well. I think we get a lot of good results with that, with not as much downtime. And it tends to be safe for all skin tones. You don't have to worry as much about having an adverse outcome, whether it be hypopigmentation or hyperpigmentation.
Totally.
I've really liked it. That's one of the few procedures I've actually had done myself, which I'm like just because I film so often,
Yeah.
I like can't tolerate too much downtime lately. And so it's something that I can do on like a Friday and be okay on like Monday.
Yeah, and no issues with pigment. Obviously, your skin is perfect. So, maybe I should go get some too.
You haven't had
You're
it done.
inspiring me to get some too. Uh,
Yeah.
what else do we do for acne scarring? I will say, non-ablative and ablative fractional lasers are great. So these are different lasers, different wavelengths. So for non-ablative, we're typically talking 1550 nanometers, something in there. And then ablative, we're looking at 2940 erbium YAG or 10,600 carbon dioxide laser. And that helps to sort of resurface the acne scar and works really well. So that's something that I definitely do, on a daily basis for acne scarring, because those are not the newest technologies, but they work really, really well. So
Yeah, I think like CO2 is one of those lasers that, again, has withstood the test of time, but you can do so much with it. So we do a lot of surgery at our office, and we deal a lot with whether it be post-surgical scarring, or even just treating skin cancers in general. But CO2 is like a workhorse for us, and we use
Mhm.
that for, whether it's treating, wrinkles, deep wrinkles on people, or treating some of the scarring that happens with acne. But we see so many good results with that. But again, that's not something that, well, it depends on the setting. So like, this is a good question for you, as a matter of fact.
Yeah.
Will you use CO2 on some of the lighter settings on people with darker skin tones?
Yeah, so really important to go to somebody that understands how to operate it. It is safe. I prefer non-ablative lasers in people with darker skin types, but CO2 also is safe in people with darker skin types if done correctly. Not to get into specifics, every device is different, but not every setting is safe in darker skin. So the density needs to be turned down, the energy needs to be turned down, and of course, in doing so, you have to trade off some results. So you really have to assess the skin type of your patient and see, because it's possible there are some options that are more colorblind per se that might be better. But I have done it. I do it regularly. I probably will continue to do it, but you just have to you really have to see somebody that is not just not just somebody that plays with these lasers every now and then, somebody that really has devoted some time to learning these settings.
Definitely, yeah, because what you can do with the CO2 laser, like you could take the entire skin off. Like you
Right.
could put this on fully ablative. You could increase the density to the point where essentially you are ablating the entire skin, and like that is like I could remove your skin. This is a really super dangerous device if on the wrong settings, and then you can get to the point where you don't feel it at all. Like the density is so low, the energy is so low that it almost feels like just heat essentially on the skin. So like the range of what you can do with the CO2 laser is actually fascinating. And then being able to select the right laser to get the right result with the minimal complications is for somebody who is an expert in these devices. So definitely worth saying there. And so let's talk about like the expectation of acne scars, because every time I do a video on acne scars, they always perform very well, because I think a lot of people suffer from acne scars and they want to know what they can do. So like say you have somebody with your rolling boxcar acne scar, or your rolling acne scars that's been there for 2-3 years. They're out of the period where they have acne anymore. Like tell us, like walk us through what you would do as far as like skincare all the way to some of the laser treatments, how many treatments to expect, and then like what to do afterwards.
Right. So, somebody with a general, a mix of scars per se. First things first is making sure that their skin is prepared for laser treatment, especially if they're darker skin types. So before doing the treatment, they're retinized. They're on a bleaching agent if need be to prevent any pigmentary disorder after the treatment. They're on antiviral treatment to prevent any, infectious outbreaks, etc. But that's included in most treatments. And then, I will typically do a combination of either laser, subcision, radiofrequency microneedling, or even for some small distensible scars, a little bit of filler directly into the scar. And so really, like I said, it's so tailored. But for somebody with a mix, I would say to expect some sort of fractional laser treatment or radiofrequency microneedling plus subcision, plus or minus chemical resurfacing of the scars using either TCA or phenol. And then aftercare is really important too. And skincare, I tell people that coming to see me and getting a laser treatment done is like going to the dentist and getting your teeth cleaned. And then when you go home, you still have to brush your teeth and you still have to floss your teeth. You can't
That's a
just
good analogy. That's a
yeah,
great
you can't just get your teeth cleaned once
analogy.
every so often. And so typically it's a course of several sessions. So, 6 to 8 weeks apart. And then, making sure that their skincare afterwards is correct. So again, that sort of depends on the treatment modality that we gave them. But in general, it involves really gentle products, gentle cleansers, etc., assuming they have no active acne. Gentle products, gentle cleansers, close follow-up. All my patients can get a hold of me and if there's anything that goes wrong. And, it works well. And I have found that acne scars are one of the most frustrating things, because before we begin it, and you mentioned expectations for acne scars, I tell my patients a scar is a scar and nothing can get rid of a scar. for good. We can make it so the scar is barely noticeable, but if you look at it in the right, it will always be there. So acne scars are unfortunately not curable, which is why it's so important to get on top of acne while it is curable. I don't know. Do you feel the same way as far as setting expectations goes?
I completely agree. You know, a scar is a scar, and you're going to always notice it more than anyone else is, right? So we could get it to the point where I would say that, like what you said is, you know, actually one of the doctors I know described it as essentially every time we treat it is like adding one more Instagram filter, but you're never going to be a different person, essentially,
Yeah,
right? Like
love that.
just you know, it's just getting you shades better, right? And to the point where other people may not perceive it, but you're going to always know that it's there, essentially. And we do our best, but I've never seen anyone with really bad acne scar that ever gets to 100%. But I've seen people be very happy with their results, especially when we always take before and after photos for that reason, right? Because we want to be able to show people. So for any physicians that are watching this or any residents that are watching this, like before and after photos are really important for that reason as well, because sometimes people are still looking in the mirror very closely and then they won't notice a difference. But then when you show them before and after photo, they're like, wow, actually this helped a ton. And that's another important reason why we do a lot of pictures in dermatology.
Right. Yeah. Photography is so important because, you know, even I look at my face when I break out and stuff, and I look at myself in the mirror, and you don't notice those when you're looking at yourself every single day. You don't notice the difference, you know. You don't, but when you see your before picture and your after picture, it's so dramatic. So that's always really fun too, to have my patient be like, "Oh, you know, I don't feel like this is working really well," and you pull up their before and after, and they're like, "Holy crap, my skin is completely better," you know. So that's one of the fun things about photography and dermatology is it does make a big difference.
Huge difference. Yeah, so I think that that's a good expectation is to see some improvement, but you know, not get you to essentially 100%. And then afterwards, I usually have people on a retinoid long term. I always tell people like when they start a retinoid for acne, you know, I mean, not everyone needs to stay on it forever, essentially, but you could, right? Because it's going to help with the acne, the post acne marks, fine lines and wrinkles that would develop with time, texture that you just get with age, and so it's one of those things that can do a lot, but it can do a lot over a long period of time. And so, you know, I have some of my attendings that I trained with that started retinoids back when the papers came out in the 70s and 80s and have been on it over the last 50 years and they look amazing. So it's
Right.
something that you can continue long term.
Definitely. I mean, I started my retinoid my first month of dermatology residency, and I've been on it since. You know, and now I practice what I preach. So
100%,
yeah,
100%.
uh,
Let's see, any last minute, do you want to go through some of the questions? My
yeah.
chat froze like 28 minutes ago, so I can't see any questions that have
Okay,
come in.
there are plenty of questions, so we'll open it up to questions. Let's see here. We talked about Winlevi. Oh, somebody said, what's the difference between post-inflammatory hyperpigmentation and post-inflammatory erythema? Do you want to sort of talk about the difference between the two?
Yeah, you know, one, sometimes it can be difficult depending on your skin tone to tell the difference between those. But essentially, and a lot of times they go hand in hand to some degree depending on your pigmentation level. But post-inflammatory erythema specifically refers to the red spots that occur where there's a high amount of inflammation and redness, and there's a vascular vessel component to those spots, right? And then we can target those with lasers that target blood vessels and redness. And then you have your post-inflammatory hyperpigmentation and dark spots that's actually due to the deposition of pigment. So anytime inflammation occurs, you get this deposition of actual melanin pigment in the skin, and we can actually use lasers to target those as well, but chemical peels and lightening agents like hydroquinone can be used as well to target that pigmentation. So they're sort of different. There's some overlap. People with darker skin tones tend to be prone to that hyperpigmentation or dark spots that occur after acne.
Right. And the important thing is looking at people and saying, you know, some people come to me, they're like, I have bad acne scarring, but there's no true scarring there. A lot of it is just pigmentation and erythema. So that's always a fun talk to have with people because they don't have scarring. Because like we talked about earlier, scarring is permanent and PIH and PI are not. So that's the exciting thing. A question about purging after retinoids. This is a popular question. Is it always going to happen? Or what is purging? Walk us through it.
Purging. Okay. This is how I describe purging to people, which I think is more common It depends on who you talk to. I tend to think it's more, in my experience, I think it's more common than reported. But essentially is the idea that when you start a retinoid specifically, or any exfoliating agent, but specifically retinoids, your acne gets worse before it gets better, right? Like, and the reason why that happens is because if you have a bunch of texture to the skin, you have these like comedones, blackheads, whiteheads, deeper acne bumps, and you suddenly speed up that skin cell turnover process, you break apart those skin cells at the top layer of the skin, it's going to accelerate the acne that you had, right? So I always tell people, like, say you were going to have 100 bumps that were going to pop up over a month. Instead, those 100 bumps pop over 2 weeks, and that's purging. But then the last half of the month is much better. And so this is basically just accelerating your acne to a better end. So purging is a temporary result that occurs with retinoids often, and it gets you closer to your treatment goals, which is clear skin. And so it's kind of like par for the course, or whatever you would call it. It's like an expectation for some people, and it doesn't happen to everybody. So a lot of people will say, I don't want to start a retinoid because I'm going to purge, but they're not people that have a ton of these sort of deeper bumps that would come out. So it really depends on the person. I would say it's like 50-50. What do you think?
Yeah, so I tell people to expect that their acne will get worse before it gets better. It doesn't necessarily mean that they're going to fully purge. They're not going to have a horrible breakout, but you know, a couple comedones here or there is par for the course. And you know, I sort of liken my analogy to the retinoid reprograms your skin, and our skin grows from the basal layer to the surface. So when I talk to my patients, I say, you know, you have to grow a new layer of skin. It takes 3 months approximately for that new layer of skin to grow, and it grows from the bottom to the top. So you have to kind of push out the old skin to make room for the new skin. So some of that old acne that was sitting under the surface will rise to the surface. And that, you know, that's probably an imperfect analogy, but it gets the point across in that I tell patients to expect that things will get worse before it gets better. And no treatment, not just retinoids, no acne treatment will just magically make your acne go away without maybe a little breakout here or there, I think, personally.
Right, 100%. I mean, even sometimes when you start Accutane or isotretinoin, it gets so bad that we would even maybe start them on steroids before or steroids during the course. And that's been a well-documented, you know, side effect, is that people have such an extreme form of purging or inflammatory acne that occurs when starting a retinoid that they need to be put on something to calm that inflammation down. And
Right.
so it's definitely well described, but again, like it's to get you towards your treatment goal, right? So the goal is better skin, and you may have to suffer a little bit in the beginning to get there.
Right. Here's a question in the chat that I get a lot in my practice with just patients coming in. What is the difference between a retinoid and a retinol, and which one do you choose to use for acne?
This is a good question. So I look at like retinoids. Retinoids are the category, right, of vitamin A derivatives. So it's like if you were to say like fruit, there's fruits are the category, and oranges and apples are part of that same, you know, the same category of fruit. So retinoid's the category. So like everything we talked about today is a retinoid. And so within that, you have retinol, you have your tretinoin or retinoic acid, retinaldehyde, adapalene, tazarotene. They all fall underneath this umbrella. Now, retinols that are available over the counter need to be converted to retinaldehyde and then converted again to retinoic acid or tretinoin to be active in the skin. And so retinol undergoes a 2-step conversion to become active the way that tretinoin is, which can be readily uptook by your cells and then act on the retinoic acid receptors inside the skin. And so it's considered to be less effective, depending on what study you read, but also less irritating because it's not as active when it starts on the skin. Essentially the same thing, it's just how far down the line they get to being there. But retinoids are the category. So when we say retinoids, we're really referring to anything that is a vitamin A derivative.
Right. And for me, for acne, I personally prefer tretinoin or stronger. That's just sort of how I think. I don't really think that typically the over-the-counter retinols cut it for acne. I think for people with anti-aging concerns, the over-the-counter retinols can have some benefits, but I don't know, how do you feel about over-the-counters when it comes to acne?
I completely agree with you. When it comes to acne, I think you go with what has been approved for acne because they've done the tests on them. And so, you know, I think adapalene, like your products that are available, adapalene would be adequate for acne over the counter if that's what you have access to. But I always say this, like, you know, and this is how I sort of stratify what's available to people, because there's a lot now available to people from their homes. right? There's teledermatology, which has become very popular. And I really think it, like, if you're trying to decide where to be in this from, bottom to top, I think what's available over the counter, your adapalines, they're good options, but they're never going to be as good as what's available by a dermatologist, which I consider to be like the gold standard for acne treatment, is like seeing a dermatologist in person. And then you have your over-the-counters like adapalene, benzoyl peroxide, and salicylic acid. And then in between those, you have your teledermatology, just because I think even if the teledermatologist is a dermatologist, I think that they can't offer you what you can offer in someone's office, which is a hands-on approach, someone to like actually lay hands and look at your skin individually and give you a very custom treatment that you can get while seeing a dermatologist. But I do think it's an option if you're in rural somewhere where it doesn't have access to a dermatologist. It's like one step closer to better skin, but just not like what I would see, what you would see if you were to see you in person.
Right. Right, exactly. And on the topic of skincare, there's a question about, does putting moisturizer on acne clog it more? And this is something that I get asked often. People don't want to use moisturizers on their skin because they feel like it will clog their skin. What do you think, and how can we find skincare products that will not clog pores?
That's a good question. So the question is comedogenic. Comedogenic is the word that you're looking for the person. Is this product going to be pore clogging or not, right? So if you look at a product and it says non-comedogenic on it, means that they did comedogenicity testing on it, which means they take the product, usually put it on someone's back, and then test it to see if comedones or pimples form underneath that product. That being said, they tested on, let's say, like anywhere from 30 to 100 people. And so just because it didn't cause acne in that sample population doesn't mean it's not going to clog your pores, but at least means that they tested it to make sure that it didn't, and at least that select group of people. So just like I say, like when I eat peanut butter, for some reason I get acne,
Right.
but peanut butter has never been shown to cause acne. But like when I eat it, I get acne. So like, who am I going to like, how can you argue with me, right? So there are people that will. So the products you want to look for is your non-comedogenic products, which a lot of products are nowadays to prevent, especially your dermatology recommended brands are gonna a lot of times have non-comedogenic ingredients. I do think people with acne should be moisturizing, because one of the components to acne, like we were talking about, the causes of acne, is inflammation, and by decreasing the inflammation, by restoring your skin barrier, will help to decrease your breakouts. And so finding a good moisturizer that doesn't clog your pores is a really good step to treating that inflammation.
Yeah, definitely. I mean, you want to look for moisturizers that are non-comedogenic. Nowadays, I would, like you mentioned, most of the ones that are dermatologist recommended are well known to be non-comedogenic, but it doesn't necessarily mean they're for everybody. And you touched a little bit on diet and acne, which is what a lot of the questions we're getting in our question box are about. And, I always tell my patients that, things like whey protein that are proven to cause acne are definitely associated, but for some people, when they eat chocolate, they break out. But for the general population, that's not the case, et cetera. So I tell people it's really individual, and acne is really individual. So if there's something that's triggering you to flare, whether it's a moisturizer, whether it's something in your diet, whether it's a shampoo or whatever it is, cut that thing out and it should help. So that it's super individual, and it's hard to make sleeping recommendations for anybody.
Diet and acne, I say, is under investigated. We don't know, right? Because in order to link a diet to acne, you would have to like eat the same thing every day forever, and then have everyone else do the same thing in order to prove it, which is like a very difficult thing to do. So I think diet is such a hard thing to link to anything. But I do think our diets play a role. We just don't know what to tell you to cut out because it's so difficult. Like right now, we know some forms of dairy products, whether it be skim milk, vitamin B12 supplements, whey protein, like you mentioned, and high glycemic or high sugar diets can contribute to inflammation and could, subsequently contribute to acne.
Right.
I mean, that's what we know. But then if you look at like the literature between like Western, like acne is much more common in the West than it is in the East. And so there has to be either a genetic component, but it really is, I think, a dietary or environmental component that is unsolved right now. And so like you mentioned, if there are things that you cut out and you notice improve your acne, I think it would be reasonable to cut those things out. But I don't think it's reasonable. So some people will say, well, I'm going to cut out gluten, dairy, sugar, chocolate, but I'm not going to wash my face. Like I think that that's not a good approach, right? Is like
Right.
restrictive diets can also be very dangerous. And so at the causes of acne and treating those like with an actual skincare products or skincare routines is going to be more effective than having a very restrictive diet.
Right. You know, we're running out of time. The last question that I want to have you answer, there's tons of questions. I'm sorry, everybody, we can't get to you all, but the last question is about sunscreen. What do you feel like, is sunscreen important for people with acne? And if so, how do people with acne prone skin choose a sunscreen for them?
That's tough. So yes, so you know, sunscreen is important for everybody. I think that especially when you talk about post-inflammatory red spots and post-inflammatory dark spots, you know, sunscreen is very important at preventing these, and it's important at preventing skin cancer. It's important for preventing wrinkles, and so. On the flip side, a lot of people feel like their sunscreens are heavy and occlusive and will make their acne worse. And so again, I think looking for non-comedogenic sunscreens that have ingredients like niacinamide, which is not a key player in treating acne, but is a supporting player in treating acne, can be really helpful. And so just trying to find the right sunscreen that fits with your skin tone is not going to clog your pores is really important. But with everybody that has acne, especially if you're using chemical peels or other exfoliants, it is critical to be using sunscreen because you're going to be at more risk of getting sunburned.
Yeah, I agree 100%, especially what we talked about with the procedures that we do, peels, laser, etc. Really important. I tell my patients out of the sun for 1 month before, out of the sun for 1 month after. So, you know, it's one of those things that is important, but it's about finding the right one for skin type. So, you know, I think we're just about out of time. Dr. Shah, any closing remarks?
No, this was great. Thank you for your expertise here, and everybody follow Dr. Gaines and follow the ASDS account here.
That's
Tell
right.
them what your handle is so that they can check out your
Yeah,
stuff.
so Dr. Shah, as you all know, can be found at Dr. Lee, Dr. Ly. ASDS Skin MD is the account that I'm on, and my personal account is Daniel Yanis, Yanes MD, and I'm in Washington, D.C., for those of you with acne-related concerns. So, Dr. Shah, thank you so much for joining us. Thank you, everybody, for tuning in, and stick around. There will be more ASDS True Skin Expert Series coming up in the weeks to come. So, thank you guys so much, and I hope everybody has a good night.
All right. Have a good night, everyone.
See ya.